Hi, welcome to Infusion Health, the podcast. I'm comedian Chris Patrick, a.k.a. Self-Proclaimed Power Man, and I'm here with my co-host and significant other, Rach.
Hey, guys.
And today we got somebody, she's calling in from Denver. Her name is Dr. Amy Novotny. She's a physical therapist, and she's a breathing and pain specialist. I can't wait to, especially last night, I had trouble sleeping. I had to get up like 2 or 3 times. I had this toothache, so I can't wait to hear what she has to say. Amy, welcome to the show.
Thank you so much for having me. It's a pleasure to be here.
So they say you're a breathing and pain specialist. What exactly do you do? Can you explain to the listeners what exactly you do?
Yeah, so ultimately what I do is help people learn how to calm down their fight or flight nervous system to alleviate pain, stress, anxiety, surgery, different things that really affect our health. And I use it by changing the mechanics of the way you breathe as well as how you position your body.
Okay.
So I kind of moved away from physical therapy into this realm.
Into this realm, you said?
Mm-hmm. Yeah, this world of helping people heal.
Okay, so if somebody comes in, they've had, do you deal with like emotional pain it's physical pain? So if somebody hurts their leg or something like that?
Yeah, so sometimes it's physical pain. Sometimes I work with them and they just have stress, anxiety, or trauma. So sometimes they don't even have like a physical pain, like from an injury or, overuse. And I do this with people all over the world. So I don't actually see people in person. It's all through Zoom.
So you're talking about like panic attacks or PTSD, that kind of thing too?
Absolutely. Work with people with that as well, because a lot of that type of trauma or pain, the emotional or mental pain, it gets stored in the body and the body can't be freed up. And so we work on freeing the body up, de-stressing it, and helping that person be able to calm their nervous system down so they can approach what's going on in their life in a calmer manner.
Okay, well, one of the things that's going on, especially in the medical, and we've done shows on this in the medical field, is that a lot of people are getting burnt out, and a lot of people are going through a lot of trauma and stuff like that, dealing with the pandemic that's been going on for the last couple of years. So have you worked with people like that?
Absolutely. Burnout is huge right now, and we can all understand why people are overworked, the emotional stress, the seeing people die. So absolutely. And learning how to calm down and have tools and strategies and feel you're safe in your body helps you become grounded so that your body is not in high alert. Because if your body is set in high alert, now anything that happens to you is going to be perceived at a greater danger or a greater stress. So if we can help you feel the safety and security in your body, you have an anchoring point. So then when things go bad, maybe in your work or just the overwhelm of the situation, you can handle it better.
Mm-hmm.
So
go ahead, Rach.
So when I'm working with my patients, I know personally myself, I've been through 4 MRIs in the last 2 years because of everything that's going on with my benign brain tumor. My last MRI, I really had some panic. I put on my essential oils and I just, did a lot of meditation throughout the MRI, because for me, I was in there for 45 minutes getting everything done what I needed to do. For me, when I'm working with my patients, I do simple breathing techniques because, of course, I haven't been trained like you. And it's, smell the flowers, blow out the birthday candles, And so what would be some other breathing techniques that you could simply do with other patients when they are having, I don't want to go do that CAT scan. I don't want to go do that MRI. I don't want to go do those things. I'm building up this anxiety in myself.
Right. So there's a lot of different breathing techniques out there. I do one that I specifically developed that is different than, let's say, box breathing, which is breathing in your nose for 4 seconds, hold your breath for 4 seconds, blowing out for 4 seconds, and then waiting 4 seconds. So there's rhythmical ones like that. There's different ones like Wim Hof, where it's hyperventilative breathing, and that's to ramp your nervous system up even more to handle like a cold blizzard or something. And that hyperventilates you. But what I do that's different, that I train people on how to use and implement, is we have to match your body position in a neutral way so it calms you down, so it matches with your parasympathetic nervous system. Okay. And by changing your body position so that your ribs are down in front and to relax your back, that helps you access your diaphragm. So to get access to your diaphragm, which belly breathing is not diaphragmatic breathing, that's abdominal distension. Mm-hmm. We want to get true access to your diaphragm. So it starts with your body has to be in the correct position so your diaphragm works correctly. Mm-hmm. And that's where a lot of breath work, it doesn't get that little bit extra. Yep. And if you can create huge radical changes in people in very short periods of time. And not to say that breath work out there isn't great. It's fabulous. There's all different types, and it serves purposes. It's great. But why not get that little bit more by working on your body position, and then you have even greater results. And that's what I teach people.
Awesome.
So when somebody comes to you, when you're doing these breathing techniques, do you sit down in a chair? Do you lay down on your back? Is it kind of like, sitting up like meditation or?
Yeah, so we go through a whole bunch of different positions, because what happens is our body changes, if we're on our hands and knees, we're standing, we're sitting, we're curled up in a ball, we're laying on our side. We have to know how to practice in all those positions. And when you change positions like that, the way you breathe changes too. Most people don't realize that. Mm-hmm. Let's say if you're laying on one side, let's say you're laying on your left side, well, now the floor or the bed or whatever you're laying on is compressing your left lungs. So your right lungs need to be able to expand more. And most of the time, people don't know how to get expansion in one side of their lungs versus the other. And so they feel very restricted and their breathing feels restricted. Same thing laying on your back or laying on your stomach. A lot of people feel like they're suffocating when they're laying on their stomach because they're not used to allowing their back muscles to relax to get air into the back of their lungs. We're taught in society the Superman posture of chest out, shoulders back, suck up your gut. When you train your back muscles to be on all the time, that limits your ability to get air into the back of your lungs. And that also compresses on your fight or flight nervous system and overstimulates it. And you go in fight or flight mode, you become locked up, you're on high alert.
Mm-hmm. So working with people like breathing techniques, and you said you work with people with pain. Like what kind of pain mm-hmm. do you like? For me, last night I was mm-hmm. tossing and turning. I had to get up. I had to take some ibuprofen. I had to take some pain medication because mm-hmm. I was this toothache was just driving me nuts.
Yeah, so I work with people. I have a dentist who regularly sends me people who have toothaches like yours. Mm-hmm. He'll check them out, make sure there's no infection or abscess, and tells me it's just their muscles. So it can be something like that, dental-wise. It can be TMJ. I work with people with knee pain, back pain, head pain, toe pain, finger pain, you name it pain, any like physical body pain. So it's pretty much everything. I even get people who have arthritis and are told they have to have a knee replacement. So I had a lady, many stories of this, but I'll give you one example. A psychologist who came to see me back in 2016 and said, I'm scheduled for a knee replacement. I'm bone on bone. There's no hope for me. I've had pain for decades, and I've been doing injections, like steroid injections, hyaluronic injections 3 times a year for a while now, daily anti-inflammatory pills for a long time. And I said, okay, well, let's get to work. And I didn't even touch her knee. We worked on getting her rib cage in position, calming down her nervous system. Because as you can imagine, as a psychologist, you take in a lot of the stressors from your client. Yeah. Mm-hmm. And so by the next time we met, she said, how quickly is this supposed to work? And I said, well, I expect to change every time I work with you. Yeah. And she said, well, the pain is gone. I said, okay. She's like, wait, I've had this pain for years. Yep. And she's like, I don't really believe this is working. I said, that's fine, but we still have more work to do, especially if you want to maintain this and not have the pain come back. And she said, okay. And second visit, she still no pain. By the second week, she canceled her surgery, and that was in June of 2016, and her surgery was supposed to be August of 2016. She hasn't had one injection, one medication since then. And she did the work. She worked She calmed down her body. She got her body back into position. She practiced her breathing. She practiced working on breathing and sensing muscles that she didn't know she wasn't using. Her body went back in a normal position. She still has arthritis, but arthritis doesn't mean pain. Arthritis is just a degeneration. Mm-hmm. Pain is a signal that your body is out of position and tissues are butting up against each other abnormally. And so we just need to change that.
Mm-hmm. Well, I'm a firm believer, like, some people say they're in pain or some people say they hurt. And it's kind of like, well, if you keep telling your brain that, your brain is going to agree with you, and your brain's going to make, but when you start to mentally tell your body that you're not in pain and that everything is going to be okay, that kind of helps take away the pain too. When you take it out of your brain, or what I'm trying to say, yeah, when you don't think about it so much, you don't keep putting it in. I'm in pain. I'm in pain. I'm in pain.
Well, I think what you're trying to say is the person can still be in pain to a certain degree, but if they work on, like Amy said, they work on other aspects like breathing, or like we talked to Wendy last week.
Mm-hmm.
She was, I'm having my brain thing. Chris, help me out.
Wendy, the doctor. I can't.
No, last week we talked to her.
We talked to her. It hasn't come.
The physical Lifetime.
Oh, the personal trainer.
Personal trainer. Yes. Rhonda. Sorry, you guys.
Rhonda's a personal trainer at a club here, at a sports and health club here.
Working on your breathing, working on that, those kind of things. You can take yourself away from other Western ailments like medications and stuff like that, because you're working on yourself in a different way. That's what.
Yeah. And one thing I do have to say, I don't believe that pain is in people's head.
Right.
From all my years of working with people, I've been sent people who are considered mongers, who are just making stuff up. I don't believe pain is in your head. I do believe that when you have a pain and you think about it, your body's fight or flight nervous system tightens up muscles around that area, because we were taught so long ago when we were young, when you have a pain, protect it and guard it. So it's ingrained in our habits that when you have a pain, let's say your tooth, Chris, you have a tooth pain. So your muscles in your mouth all around that tooth start to contract without your awareness. It's called sympathetic tone. It's guarding to try to protect you in effort to heal you. But the problem is sometimes that system gets overworked, or it gets set on high drive because we already have other stresses in our life. If we didn't have all the other stresses in our life and you get that one pain and then your body goes into protection mode, that would be one thing and it would be fine. But it's because it's already set on high alert, the muscles go into overdrive. And so that's where there's an actual physiological process of the pain that happens. And so people will get benefits when they just mindfully say, okay, I don't have pain, just ignore it, go on to something else. What they're doing is they're just distracting their brain. The problem is still there, but what's happening is they're going and focusing on something else. So the fight or flight nervous system isn't kicking in as much, so they don't notice the pain as much. But that's also why at night people's pain seems to increase more, because the brain isn't distracted and they're quiet, their mind is quiet, and so the pain can increase more because they're stationary. The fight or flight nervous system can kick in full drive, and the muscles start to contract more abnormally.
That is so well said. That is so well said.
So it's kind of like you're putting the pain on the back burner, but then when you are sleeping at night and you are relaxed, the pain comes knocking on your door like, hey, I'm back. I'm still here.
It does, because the other thing is, so this is related to sleep, because I help people with sleep. So if you're going about your day and you're in high alert mode, you're stressed, you work, finances, driving, pandemic, whatever it is, you're on all this high alert mode. Your body starts to reflect being that. So muscles tighten up, you're guarded, you may feel buzzed, you may feel tight, you just feel like you can't settle down, you can't calm down. Well, just because you close your eyeballs at night doesn't mean you're going to relax. It doesn't mean you're going to fall into sleep. And the reason is your body's been trained to be on high alert. And just closing your eyeballs doesn't mean, okay, now you know how to relax. Well, you've forgotten because you trained out of it. So that also is why people's pain increases more during the day, and why a lot of people have trouble sleeping is because they forgot how to calm down because they never practiced it during the day.
Mm-hmm. So like I said, is it kind of like meditation, or how long should you practice this? Like 5 minutes, 10 minutes, 20 minutes?
Yeah. So I'll tell people like 5 minutes when you first wake up, kind of work out the kinks from sleeping overnight. Then I usually say if you could do it for 5 minutes or a couple minutes before lunch, just to help you calm down from any stressors throughout your morning. It also helps you when you calm down and you work on breathing and repositioning your body. It helps you with digestion. So then I would do it again before dinner to work out the kinks of the afternoon. And then right before you go to bed, just to help calm you down so your body recognizes that, you know what, I can go to sleep. My body knows how to relax and I can fall asleep. And I mean, literally, I'll go 1, 2, and I'm out.
Mm-hmm. Yeah, because a lot of things I do, like when I have stress at work, or when, it's been like a really busy day at work, I usually work out after work. But working out really seems to help me. And I work out late at night too, like around midnight. So that really seems to help me. For me, that really helps me get rid of the stress. And then when I go home, I sleep like I sleep like a baby,
Yes, workouts will do that for people because your movement helps you calm down your nervous system. So movement always helps with getting good blood flow, getting, the right hormones going through your body. But the other thing that movement does is it allows your back muscles to relax and contract instead of being in a full contraction mode. And that also helps to calm you down. It also gets you breathing so that access to the diaphragm a little bit more to stimulate the vagus nerve and calm you down as well.
Mm-hmm. Well, I know that like times at the house, because dealing with the kids, Rachel's screaming. Sometimes she's like screaming. I'm like, will you just calm down? You need to relax. Like go upstairs.
I'm naturally a screamer, but he has told me just walk away, calm down, bring it back. But my question for you is, when people are in their panic and they've come to you, now, how do you've taught them, some people, do this like 5 to 7 times a day. For the people that have panic or chronic pain, how do you teach them to move throughout the day? And especially the people with panic. I mean, this can be all of a sudden I got panic. How do I breathe through this?
So one of the things is when we start, so I usually start with people and they're really ramped up.
Yep.
And so I have to let them tell their story. They have to get it out.
Yep.
And then we start by working in seated typically, depending on the person. Sometimes we might have them lie down, but typically we start them in a seated position. So you're trying to get gravity away from them. You're trying to get them away from maintaining their balance, standing up. We want to get them out of a standing position because standing is just synonymous with kind of being more in a fight or flight mode, ready alert mode. So we have to take away anything about them that keeps them in fight or flight mode. So we're going to put them in a chair if they find that comfortable, lie them down on their back if they find that comfortable. And so we have to start with your base, which is your body. And we start by teaching them how to change their body position and their breathing together to calm them down. And basically, we're working to get the breastbone to melt in. Most people in panic, they feel like they can't breathe, they're short of breath. Same thing in chronic pain. Anyone in chronic pain or panic, the breathing mechanics completely change. You can watch someone And I've done this. I've been on Zoom with people, and they're calm completely. They have a certain breathing pattern. It's very soothing. Something happens, flares them up. Their whole breathing mechanics change. Their ribs lift up. Everything has become shallow. They're using their back to breathe, their ribs to breathe. They've completely lost access to their diaphragm. And they've lost the ability to sense their breastbone melting in. And that's where we generate a lot of safety. It starts from that breastbone. If the breastbone can melt in as they exhale, they can start to feel this whole calming effect over their body. But most people aren't able to access that. And that's something you want to get before you can go to sleep too, is can your breastbone melt in to release? And most people, because when they breathe, they suck their gut in to breathe out, they can't feel their breastbone relax or melt in, so they can't relax. So most people, they breathe in a way that dictates they will be in high alert, they'll be in panic, they'll be in anxiety, they'll be in chronic pain because of the way. We have to work on that, and we start shifting them slowly. Ideally, we want to work on getting them calm first, then have them continue to practice while calm. Then as they go through a situation that triggers their panic, they can start to implement it. It's not going to be perfect at first because their habits are so strong on how they respond to panic, but we have to work on the mindset and say, guess what? The next time you have a panic, this is your opportunity to practice.
Yeah.
You are given a chance to practice this technique to see what you learn and what your body has retained from what we've practiced when you felt safe.
Mm-hmm.
So we start working through it so that it can help them and shift them.
Very cool.
Yeah. So how do you when somebody is in panic, how do you get them to calm down? Because I'm in panic and it's going crazy,
Well, they're in a mindset right at that time, so it's talk through and breathe through.
Mm-hmm. So,
right, kind of what I just described. I would go through that process with someone in panic. I'm going to take them through that full process, and depending on how they respond, we're going to work on creating that safety in their body. So, as long as they can feel something safe first, then we can address whatever's triggering them.
Mm-hmm. Yeah, because I've heard of people like Dr. Sornall. He a lot of people had really, really chronic back pain, really bad, and I know a few people who's like, yeah. Once I read his book, I was like, fine. I was able to move. I was able to play basketball. A friend of mine told me that I was able to play basketball after reading Dr. Sornall's book. But he was more like, it's all in your head. You don't have this back pain and stuff like that. But there was a certain, I don't know if he wasn't doing the breathing techniques, but he was doing something like trying to tell him that it's in your head, that this is all made up in your head. And he's cured a lot of people, but the regular medical industry doesn't recognize him,
Yes. So he does talk to people about that, and he does talk about how a lot is in your head. And I think what he accomplishes by telling people it's just in your head is when you tell someone it's just in your head and it's not real, guess what your nervous system does? It's going to relax a little bit.
Yeah.
So then the muscles release. So he's helping people do part of the work. But I work with many people who have something called TMS, or it's type of it's kind of related to what Dr. Sarno does, but I work with those people as well, because what will happen is they'll say, okay, I have TMS. I have this condition where I have these pains are all over my body. And then they say, well, it works temporarily, but then it flares back up. And I say, well, you have part of the equation where you're using your mind to calm your nervous system down, but your body has changed. So now your nervous system is still triggered by your body position because you're holding your body in this way. So we have to get that part too, especially if you want to free your body up as well. So that's what we work on.
So it's more like, like you said, freeing your body up, not tensing up so much and relaxing.
It is, yeah. So TMS stands for tension myositis syndrome. So it's basically saying that your muscles get inflamed into a tense state. and it leads to pain. And so people think, okay, if I just tell my brain I'm not really having that pain, it can go away, which it can.
You're just escaping
if you don't do anything. You're escaping it. And if you stay in a very steady state, you walk, you sit, you're just very careful, yes, it can help. But as soon as you go to do something more elaborate, maybe go for a run or hike, it may not be the solution completely, because your muscles go into a guarded protective state every time you do something new, or every time you do something that ramps your nervous system up a little bit. Then you start to get that pain again, because you really haven't changed your control over your nervous system. And so that's where we go a step further to help you learn how to control your nervous system, so that, like, for instance, I'll run marathons pain-free, 50 milers pain-free, because I know in the middle of the run, if I get tired or I'm running on a slant or I trip and fall, my nervous system's going to get ramped up, but I know how to control it back down, so it frees up my muscles, frees up my body, and it can continue running pain-free.
You said
50, so it's a skill.
You said 50-mile,
yeah.
50-mile marathon?
Races, yes. Ultra marathons, yeah.
Oh, I was like, wait, a marathon's like 25 miles or 20 miles.
26.2 for a marathon, and then ultra is anything greater than that, yeah.
That's awesome.
Well, running 50 miles pain free is like, I mean, because if I ran a regular marathon, let's just say I'd have to be wheeled off the track.
No, that's all in your head. You just haven't learned these skills yet. That's all.
Well, and that's the thing too with being a runner, because I know when I used to run, it got to a certain point, like halfway through, to where all of a sudden I just got what I think they call it euphoria, where I could just like, I feel like I could run 100 miles. I was just, I was like Forrest Gump, but you hit that kind of in the middle of the way. Like, I was just like, okay, I'm here now. I'm relaxed, and all of a sudden it's just like I just feel I could run forever.
Exactly. You calmed your nervous system down enough that you just allowed your body to move. Mm-hmm. And that's the goal that we want to get everyone in no matter what state they're in. If you want to just stay calm and allow your body just to move naturally and not tense up. Mm-hmm. But often the way we put ourselves, the position we put ourselves in, forces tension and forces us to lock up, and then changes our breathing mechanism. And that's what I hope to change people's mind about, and say, you know what, really examine your habits. Look at what you're doing, because you have more control over your body state than you think.
Mm-hmm. Oh yeah. You do have a lot more, like you said, a lot more control of your body. It's just one of those things is how you use your body.
Yeah, definitely.
Mm-hmm. Yeah, absolutely. Like, for instance, your tooth pain, Chris. Highly likely the muscles, is it like your upper tooth, lower tooth?
It's my lower tooth. I think a filling came out, and I think it's kind of hitting on the nerve. Yeah.
So obviously you need to get that checked, but the muscles around that tooth, like in the lower part of your jaw, mm-hmm. you can do gentle massages and breathing and relax your chest in, let your belly come out, and you can actually decrease a lot of that pain. Mm-hmm. It's very powerful, but it's a matter of learning to sense that and learning to sense those muscles relax. Mm-hmm. That can really help you. If you just go and you just blow and just like, okay, this is good, it's not going to be that effective as if you can say, you know what, let me feel what's happening. And the awareness is the hardest part. So my business stands, it's PABR, PABR, mm-hmm. stands for pain, awareness, breathing, relief. The awareness part is so critical, is what can you feel and not feel in your body? And as you start to realize that maybe you can't feel something, that's when you get help from someone, me, someone else, whatever, mm-hmm. and you can start to make changes. And that's when you start to gain power back in your body.
Okay. Well, this has been an interesting conversation. Real. I've learned so much. If somebody wants to get a hold of you, what are some? Mm-hmm. You got a website or mm-hmm. or you got a website or email or some way that somebody could get a hold of you if they want to
give it to us, and then I will have you text it to me, and I will put it in our link.
Sure. It's paberinstitute.com, pabrinstitute.com. And if people want a free consult, a 15-minute free consult, just to kind of help them figure out what they need, whether if it's free resources or more than that, to send me an email and tell me they've heard me on your show. That way I know what I've described to them. And it's Amy, AMY, at pabrinstitute.com.
Okay. Then, are there any literature? Is there any books or anything like that if people want to get started on this?
I have some resources. I think the best resources will be on my website. It's some interviews and media, and those would probably be the best resources right now. I have some I'm part of a couple of anthology books where I describe the process a little bit, but I'm halfway through writing a book on this whole process itself.
Awesome.
Okay.
Awesome.
Well, when you finish your book, you got to come back on.
Absolutely.
Okay. Okay.
Yeah, stay in contact so we
Okay.
can definitely get you back on. All
Thank
right.
you. I appreciate you too.
Oh my goodness, so much. All right, so we're
Thank
going to
you.
close down, and you guys, history is born on lines of hate, and here we're trying to build lines of love and make you guys your best advocate. If you appreciate what you liked, stay tuned. We're going to educate you with more, and until next time, hey, we're out.
Thank you.